Hi, I'm Dr. Bojack from Chiropractic in Stoneham, Mass. Okay, today's posture tip is regarding our traction, our spinal traction to increase the cervical lordosis or cervical curve in the neck, and to provide upright shoulders to get you out of that rounded shoulders or the anterior translation. Okay, we've already had a clip on passive traction. Today's active traction. Okay, so active traction, we're going to actually be pulling you, okay, creating a pull back here with 120 pounds of pull on a spring, which is going to actively influence the ligaments. Okay, so muscles and tendons stretch, ligaments creep. Okay, distinction, and the distinction is that in order to stimulate the ligaments, you have to create a lot more torque in there and a lot more tension to actually stimulate and activate those ligaments as a consequence to that. So that's exactly what we're doing here. Okay, so Suzanne's going to just drop back here. Okay, and she's already been doing the passive, and I won't suggest anybody doing active before they do passive, right? Because you don't believe it, you might not realize it, but it is a real hit to that neurology. Okay, so what we're going to do is we're going to put this harness on this, and like I say, this harness is connected to a spring, and that spring is creating 120 pounds of pull back there, so there's some good torque that we're creating here. Okay, so all we're going to do is pull it and create some tension in here and drop it. So okay, so she's just pretty much relaxing, okay, in there. So the head's starting to drop back, so it's going into that cervical curve, right? And her shoulders are dropping back also. Okay. Now she always has the availability, right? If it's too much for her, all she has to do is slide down. When she slides down, it reduces the tension on that pull, okay, according to her personal preference, right? So we're never going to do anything that anybody can't tolerate here, okay? So we start them off with 2 to 3 minutes, and our goal here is work them up to anywhere from 5 to 8 to 10 minutes. In actuality, we started her low, but our goal here is to get these shoulders to touch these posts, okay? So see the actual amount of work we can do with her, right? So we want to start bringing her up more and more and more so her shoulders are touching the post, and that creates a lot more leverage. It creates a lot more change and not that much more improvement in the musculoskeletal structure of her spine and that upright posture. Okay, so about when we're done with it, 2 to 3 minutes, right? Okay, so she'll turn her head and she'll roll to one side, okay, versus coming straight up, because coming straight up is a real kind of a shock to this neurology. So you want to roll to one side, sit up. More often than not, when you sit up, especially if you've had these postural distortions, you're going to get lightheaded or dizziness, and you're probably already getting that. Right? When you change postural positions, going from a seated to standing or laying to standing, or just rolling from a laying to a sitting position, I got a hunch you probably already got some postural distortions or neurological involvement, that you get some dizziness, lightheadedness, queasiness, any of that stuff. And those are just signs that there's neurological involvement going on in there already. Okay? So this is just a real quick distinction of our spinal traction, okay? Again, one being passive without the pull, the other being active with the pull, okay? And then our actual regimen here is after we get our patients come off of traction, they're always doing the spinal twist, okay? Because what we did is we just opened up that structure, and we want to create further movement and mechanics and motion in there, okay? So again, thank you so much. We really appreciate your time and your effort to watch these clips on posture and spinal mechanics. Love to see you at our clinic to check you out and see what you got going on and give you a consultation and our opinion. Our phone is 781-GET-WELL, 781-438-9355. Love to see you.